What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll be learning what is the primary job / responsibility as an X-ray tech. Alrighty, to give you some credentials, I am an X-ray tech, night shift in Trauma 3. Alrighty, so the most basic terminology. We're just talking about plain X-ray. It is to obtain the best possible diagnostic images using radiation to see what's wrong with the patient. Basically, that is the most simplest, both keeping yourself safe and the patient safe to get the best optimal pictures. That is like the most plain and simple terminology. Therefore, as far as what we do job, it all kind of depends on what kind of, area of the X-ray department you're in, because there's like the main radiology, which that's what we kind of call it. That's where all the fluoro exams, which I guess for those who don't know, fluoroscopy is when you use active radiation that gets shoot in, let's say someone will drink a contrast, which contrast is essentially a white powder substance, or gastrographin, which is like a liquid. And you'll drink it and you can see internally what's going on. So as the patient's actively drinking it, will shoot radiation so you can see like inside their intestines for any obstructions, or if dysphagia, which is that means you can't swallow and stuff, different things that's wrong inside. And then you have enemas, which is same thing as drinking, except it goes from your butt inwards to see what's going on in there in simple terms. And then they also do lumbar punctures, which sometimes they'll go in with the big giant needle, poke you to see your pressure and your spinal fluid and a bunch of other stuff. And then there's hip injections, which that one's to get relief of the hip, or that's mainly what they use it for where I work. Same thing, arthrogram, they'll do that too. Or especially people who have the G tubes, G tube, one of those tubes that's either from your stomach or from other stuff. Sometimes you don't need X-rays to do those, but some of the patients who are harder to get those tubes in place, they'll use fluoroscopy to be able to get those pictures. So that's kind of the main radiology. And then you have the ER, which that one's depending on your level of ER you'll go to. You'll have just the plain X-ray will be there, and then there's also CAT scan and stuff. But that's outside of the X-ray department. And then we'll have, usually if it's where I'm at, it's just X-ray. Certain trauma 2s and trauma 1s, they also have overnight fluoroscopy. Then you have the C-arm, which that one's mainly used for surgery, which in basic terms, I call it a giant headphone that spreads radiation. One of them pulses the radiation onto the other ear cuff, and usually the patient will be sterile. Sometimes they're not sterile. And then it will kind of maneuver so you get different angles for the patients. Usually those come in for surgeries to see if you're getting some pins and needles or something put in. You can see it's for the doctor to see if they're in the right spot, or to see what they're working with. So that's in a sense the surgical side of the X-ray. And then we have, what else we have? X-ray, and then you have the patient outbuilding, which that's another part of our department, which that one also mostly just consists of X-ray. Some hospitals also do have X-ray techs take EKGs. some. And then there's other places where you will, more in smaller clinics, you'll have to do like lab and some like a little bit of medical assistant work type stuff. Like that's one thing. I personally don't like that. That's why I work at a hospital, so the nurses and all that have to do that, and I don't. So IVs and stuff, like we as plain X-ray tech don't have to really deal with those much. I mean, if you go to CAT scan, you will, since you are actively, injecting contrast and stuff. And then we have like Alara, which is like the lowest amount of radiation possible to get the images, which that's kind of our little standard we use. Which that one mainly comes into play when you're thinking about like the surrounding patients / other medical workers / how much radiation have I given this patient. More for surgery, because sometimes in surgery you'll have to be careful, because like the doctor will be like, "I shoot him, beep." Especially in fluoroscopy, where you're actively just like like shooting radiation and stuff. You'll have to be a little bit more mindful compared to like to plain X-ray. You'll just beep, and then it's just like that little beep is the amount of radiation that's spread. Like once the beep is done, like radiation just stops. I mean, there might be scatter radiation, but that will be occurring. I want to say that's like the most basic way I can put what we do in X-ray. Is just take images of the patients who are trying to see what's wrong with them in like the most basic terms. Or I mean, some nurses see that as a button pusher. I mean, sometimes that is. So yeah, hope this helps the general public, or for those who are coming into our department and wondering what we do. Yeah, it's been your boy Miguel. See you on the next one.